Hi, I'm Dr. Sam Wild, a GP of over 20 years and the Women's Health Clinical Lead for Bupa. Today, I'm going to talk to you about what a prolapsed bladder is. If you've ever felt a heaviness or dragging sensation in your pelvis, or noticed a bulge at the opening of your vagina, you might be wondering what's going on. It could be something called a prolapsed bladder, and whilst it can feel alarming, it's actually common, and there's plenty that we can do to help you. In this video, we'll talk about what a prolapsed bladder is, what causes it, signs to look out for, treatment options, self-help strategies. A prolapsed bladder, also called a cystocele, is a type of pelvic organ prolapse. It happens when the tissues between the bladder and vaginal wall weaken, and the bladder starts to bulge into the vagina. Now, people often ask, is that the same as a vaginal prolapse? And it could be, but a prolapsed bladder is one type of a vaginal prolapse. When we say vaginal prolapse, we also could be talking about a uterine prolapse when we see the cervix coming down, or a rectocele when the rectum pushes into the back wall of the vagina. But with a cystocele or prolapsed bladder, it's the bladder that's pushing into the vaginal space. According to NICE, the medical governing body in the UK, up to half of women who have had a vaginal birth may have some degree of prolapse, though not all will have symptoms. And around 1 in 10 women over 50 will need treatment for it. There are a few things that can lead to prolapse. Number 1, childbirth, especially if you've had multiple or difficult deliveries. Number 2, chronic straining. This could be from constipation or heavy lifting. Number 3, chronic coughing. Number 4, aging and menopause. The hormone estrogen is essential to collagen production, which keeps your muscles firm. As estrogen levels drop in the lead up to and after the menopause, muscle tissues in the pelvic floor lose their strength, and this can cause prolapse. Number 5, previous pelvic surgery. And number 6, sometimes it's just genetic. Some women are more prone to it. You might notice a dragging or heavy feeling in your pelvis, a bulge or feeling that something is coming down at the vaginal opening, discomfort during sex, or bladder symptoms like struggling to start a wee, need to go more often, or leaking urine. Some women describe it as feeling like they're sitting on a small ball or like something's falling out. And sadly, many women live with this for months or even years before seeking help. But there are lots of ways we can manage a prolapsed bladder, and we usually start with the least invasive, which is pelvic floor muscle training. NICE recommends supervised training for at least 16 weeks. So what is a pelvic floor muscle exercise? It's as simple as trying to contract the muscle between the vagina and the anus, squeezing it tight and then letting it go. And that is 1 rep. We usually say try to do 10 to 15 reps 3 times a day. But it's best to work with a physio to make sure you're doing them properly. And if you're doing things like heavy lifting at the gym, it's even more important to engage your pelvic floor and to use correct technique. Make sure you exhale as you lift, don't hold your breath, and always think about zipping up your pelvic floor. Another treatment option is to have a pessary. This is a small removable device that's inserted into the vagina to support the bladder and relieve symptoms. For some of the types, some women can learn to manage them themselves, taking them out before sex, for example, but others will need to be changed in clinic. Pessaries are a good option if you're not ready for surgery or if surgery isn't suitable for you, but they're not perfect. Some can fall out, cause discharge, or feel uncomfortable. If symptoms are more severe or other treatments haven't helped, surgery might be an option. Surgeons will tighten up the tissues to support the bladder. Surgery is very effective, especially if the prolapse is significant. It's usually done under general anaesthetic in theatre. Recovery usually takes at least 6 to 8 weeks, and while it can make a big difference, prolapses can sometimes come back, especially if the tissues are already quite stretched or weakened. Some women, therefore, might still need a pessary or further treatment afterwards, depending on how things heal. Number 1, use safe lifting techniques. Exhale on exertion, engage your pelvic floor, and avoid breath holding. If you're lifting weights regularly, make sure your technique is spot on. Number 2, maintain a healthy weight. Number 3, prevent constipation. Eat plenty of fibre and stay hydrated. Number 4, keep active, but avoid high-impact exercise if it worsens your symptoms. Work with a trainer or physio if you're not sure, especially if you've had children or are going through the menopause. Thank you for watching, and if you'd like to know any more about bladder health, please have a look at our series of videos below.